Now we're going to do taping for the shoulder, and specifically in and around the rotator cuff issues that we have around this area here, because we've got the supraspinatus, the infra, we've got teres here as well, and even the subscap around the front here. So in order to tape this and offload these areas, we're basically going to tape around the shoulder itself, and then we're going to decompress over the site where the cuff is. Now, even if you've got AC joint pain, you can tape over there as well. This is not unlike what we've done for patellofemoral a little bit. The fact is, obviously there's no patella involved, but we're actually taping around the joint. So we're lifting and offloading around that, and then we're decompressing over the side of the pain. All right, now important tips. Length of your tape. So we've got the AC joint there, so we're going to basically go from just above the AC joint all the way down, basically the tip of the deltoid tuberosity. So that will be the cutting length that you want for this taping technique. All right, so round your edges off. We're going to put a split through, not unlike we did for patellofemoral, about 1 inch from the top. And the idea is that we're going to wrap these around like so. Okay, now the trick is in actually getting this centered right so that you get an even spread around the actual joint itself. So if you go too far back, posteriorly, you're not going to be able to get around to the anterior, and likewise if you go too far anterior, you won't be able to get round to the back. So that's the trick with this taping technique. Peel your edges off. So for your anchor, so that's going to come down. So we're going to go basically right where the V is going to be, right at the deltoid tuberosity. So we'll see here, you've got your two tails here. So hold the bottom. So we're going to go about there. Now if we do this right, we should be able to meet the two tails across the actual AC joint itself. All right. Peel your tails down. So we're going to go do the anterior first. So what's most important here when we're doing the anterior is that we're coming around the front of the shoulder. Now we're just going to bring Kurt's arm out, okay, and a little bit of external rotation like so. Okay, so we want a little bit of a stretch on it. So we're going to come around, place that down, no stretch, as you can see, on the tails, on the very end of the tails. Remember, there's no stretch there. So the posterior tail now, so just pick up the backing. This time we're going to bring the arm into internal rotation, and then we're going to wrap the tail around there. And once again, if we do this right, we should meet together just above that AC joint like so. Okay, bring that back there for us. So now what you're looking at is we're coming around the joint itself. That's exactly what we're after. Okay, now stabilisation. Tape is going to go basically right over wherever we feel the pain. So if it is rotator cuff, obviously supra, infra, teres, or even the subscap, this is going to be perfect. But this is also a great opportunity to correct some posture as well. So what we'll do is we'll bring Kurt's shoulder just back into a little bit of retraction, get him to lift a little bit through his thoracic, hold it there, and then we're going to tape that there, because that will also give him some feedback here for his scap stabilisation. All right, so don't forget, round the edges. Okay, length of your tape is important, but not so important this time around, because obviously it's going to end up coming down here towards the lower part of the trap. So we tape literally right onto the soft part of the pec muscle. Okay, so we're just going to lay that down with no stretch whatsoever until we get to this point here where we're going to put it on about 80%, like so. There we go, and then lay the rest down roughly at around about 60%, like so. Okay, and that's done. So we've offloaded, decompressed across the rotator cuff, lifted around the shoulder, and then obviously we've adjusted at the back here some feedback for the scap stabilisation.